Thanks for staying with us. Now let's continue our discussion about the situation at Rahima Moosa Mother and Child Hospital in Johannesburg. The facility was thrust into the spotlight this week after a paediatrician was suspended for speaking out about the conditions there. Following widespread anger, Dr. Tim de Meyer has been reinstated. Now let's bring in Nehawu's Mzikayise Tshontshi. Thank you so much. You are the General Provincial Secretary. Thank you so much for your time. We do appreciate it. Perhaps just your response to the fact that Dr. Tim de Meyer was in fact suspended because of his scathing letter about the state of Rahima Moosa Hospital, and then because of the public outcry, he was reinstated in that position.
Greetings to you and your viewers. We learned with shock as Nehawu about the said suspension, which from our view, it didn't follow any of what is expected from an employer when they contemplate to suspend an employee. We are happy that the department came to its senses and reinstated him.
I want us to speak about the obvious and the writing on the wall about Gauteng health facilities and how they are not regarded, they are under-resourced, there's not enough budgets allocated, and doctors have to find themselves in very difficult positions. For example, Dr. Tim de Meyer speaking about how doctors have to use their mobile torches when there's load shedding. As Nehawu, are you aware of how dire the situation actually is, and what are you doing about it?
We are very, very aware that the state of hospitals in Gauteng is shocking, to say the least. We have brought this to the attention of the MEC, who is actually aware. You can go throughout the province and see the conditions under which workers are working, all of them, nurses, doctors. It's very shocking, the state of the hospitals. In fact, all institutions of health, and the MEC is aware. What is surprising to us is that very little is done to try and correct the situation and make sure that people work in conditions that are favorable to the outcomes that are expected. The state of the hospital is a serious disservice to the communities that are served by these hospitals. And I can tell you, nurses, doctors, and all other workers are burnt out, working under very difficult conditions, very gross shortages of staff. The state of the hospitals themselves, the buildings, leave a lot to be desired.
I want you to perhaps explain your engagement with the MEC of Gauteng Health in the province, because as you mentioned, the MEC might be aware of it, but it's one thing to be aware and it's one thing to actually act and do something about it. And many use the example of, for example, Charlotte Maxeke, when it burned down, it put immense pressure on other hospitals, and there's just been delay after delay, and this has now had to move to national to take over because provincially things are just not getting done. Again, I'm going to perhaps rephrase it. What is Nehawu doing? What engagement is Nehawu having with Gauteng Health for Gauteng Health to understand the severity of this? And people are losing their lives. Children are dying because hospitals are under-resourced and they just don't have the necessary equipment.
We have had a meeting with the MEC, 2 meetings with the MEC. First, the meeting was called by the MEC herself, who was introducing a program that is called Serve with a Smile. And as Nehawu, we questioned the very project of Serving with a Smile, because it seems to suggest that people are working in an environment that is favorable to smiling. Because as far as we're concerned as Nehawu, we did indicate to the MEC that there's nothing to smile about the state of our health institutions. And we would want to urge the MEC to correct the situation. In our second meeting with her was about Telemforane Hospital, where they had suspended COVID employees while there are so much gross shortages of staff in this particular hospital. And we have other planned meetings that we intend to undertake. But over and above that, because of the slow progress that the hospital, the Department of Health rather, is taking, Nehawu has taken a posture that we are going to embark on a program of action to pressurize the department, to prioritize service delivery to the citizens of this country. And further to that, we want to put pressure on the department to actually make sure that the improvements that are expected are actually effected in the shortest possible time.
Any details about this action that you are planning, or are you still discussing it?
At the moment, we are still discussing it, but if I can tell you, the things that are concerning us are the shortages of staff. The things that are concerning us is the state of the institutions themselves, security issues. We've had a discussion for a long time with the department about insourcing of security services, but somehow this is hamstrung. So those are some of the things that we want to bring to the attention of the MEC and indeed the attention of the Premier of the province.
Okay, thank you so much for your time. We do appreciate it. We'll definitely be checking in with regards to that planned action, because it just seems as though nobody else is really listening.